But first, information regarding National Childhood Cancer Month with Erlanger. We are joined by Dr. Manoo Bhakta with Erlanger. And interesting stat here, 90% of the kids diagnosed with cancer in this region are able to stay here and get treatment here at Erlanger. And part of that is because of what you did some 30 years ago by bringing a very comprehensive cancer unit here to Erlanger. So first of all, welcome to the show. And why did you want to bring that to Chattanooga some 30 years ago?
Yeah, thank you, Brian. 30 years ago, when over 90% of the children used to actually go out of town, and it was devastating to the families. A lot of marriages were broken up, the other siblings were affected. The care of a child required a tremendous amount of commitment. It required a lot of time and effort and months and months, and in some cases years. We were able to come to Chattanooga and build a program here. Obviously, it had to be done gradually, carefully. We had to have the standard of care that has to be as good as anywhere else. You don't want to compromise on the ability to cure or have outcomes that are very healthy and such that the quality of survival is excellent. So over time, we've continued to grow the program, and today we're proud to say we are one of the cancer centers throughout the country of a team with the Children's Oncology Group. That's the other preeminent centers like Vanderbilt, Emory, St. Jude in our region. We all team together and work together in treating children with cancer.
Now, it seems like over the course of 30 years, obviously medicine has changed tremendously, especially when it comes to pediatric cancer. What have you seen over the course of those 30 years, and where do you think we're going, especially with the research and curing?
That's a great question. We've had over 30 years, and I've seen this evolve over the time, and it's been incredibly exciting. When I first started, we used to cure about 30% of the children. Today, the cure rate is 85%. Wow. From our first attempt. And even then, thereafter, there are other options available. So the cure part is now dramatically better. Obviously, we want to cure every child.
Sure. Now, September is Childhood Cancer Awareness Month, but there is a difference. Obviously, cancer is something that will break anyone's heart, no matter what age it is. But the difference between pediatric cancer and adult, where is that?
There's a big difference. The type of cancers that we see in children are more such that we see a lot more leukemias and lymphomas, cancers of the nervous system, brain. They're a lot more aggressive than you see in adults. The good news is that you would think that a very young child or an infant is delicate and will not tolerate aggressive toxic therapies, but actually the biology or the body of that person is such that they can take toxicity a lot more than, say, an adult would. And as a result, we have increased our intensity of therapy. We give a lot more intense therapy in children than you would in an adult, but we have made such a lot of progress in supportive care that we're able to do this effectively. And partly, the main reason we get such a huge cure is because of that.
Now, when it comes to a parent and we hear that word cancer, again, we think about our children. We're going to do absolutely everything we possibly can to keep cancer away. But sometimes there's so many studies, there's so much advice out there, and possibly even negative advice out there too. What would you tell a parent that that's a preventative measure, or what can they do?
Yeah, that's especially in these days when people have access to internet and all kinds of information, and it's our job to sit down with the parents, to educate the parents, to help them navigate through this incredible plethora of information that they have easy access to. And that's why we do a lot of, because part of coping is to understand what you're dealing with, the adversities you're dealing with. And we have to do a lot of processing of all that's out there at their fingertips. At the same time, direct them to valid information.
Well, thankfully, we have a location here in Chattanooga that represents the region, and especially what you and your team have done as well, especially over the course of 30 years, and starting that up here in Chattanooga and making a big difference as well.
Thank you, Brian. We have a great team and great nurses. Appreciate having you and me here. Thank you.
No problem. Okay. We appreciate it too. All right, folks, for more information, of course, September is Childhood Cancer Awareness Month, and for more information about all the things that Erlanger does, you can call them at 778-5465. That is 778-5465. You can also go to the website, which is erlanger.org/children's. Folks, we'd like to say congratulations going out